Hi, my name is Karen Fang, and I'm a third-year medical student here at Lake Erie College of Osteopathic Medicine. I'm here today with my classmates, Jacob Robinson, Jenna Mamatov, and Pruta Patel. And today we're presenting our topics on the effects of docosahexaenoic acid on bronchopulmonary dysplasia in preterm infants.
Bronchopulmonary dysplasia is a chronic lung disease that occurs in infancy, primarily in infants born at less than 32 weeks gestation. Those born at less than 29 weeks are the most at risk. In North America, nearly half of preterm infants born before 29 weeks of gestational age are affected by BPD. BPD is characterized by an inflammatory process that results in alveolar hypoplasia, small airway dysfunction, and impaired pulmonary vascular growth. This results in possible long-term pulmonary, cardiovascular, and neurodevelopmental impairment. BPD results in longer hospitalizations and can cause respiratory symptoms in children that can even persist into adulthood. Reducing BPD will help in decreasing healthcare costs. A randomized controlled trial conducted by McBride and others in 2001 to 2005 suggests that supplementation of docosahexaenoic acid, or DHA, a long-chain polyunsaturated fatty acid in preterm infants decreases the incidence of BPD. The use of DHA, when less than 315 milligrams per day, as a sole source of nutrition in infants and as a supplementation in adults has been shown to be safe and has not been found to have any adverse effects. However, Collins et al. Conducted a study from 2012 to 2015 that suggested that DHA supplementation to infants born before 29 weeks of gestation did not decrease risk of BPD and may even increase the risk for BPD. Due to the inconsistent results found between these trials, a new trial by Mark et al. Was done in 2015 to 2018 to determine if DHA decreases the incidence of BPD in infants born before 29 weeks of gestation. This meta-analysis aims to reevaluate the effect of BPD in preterm infants with the addition of the Mark et al. Study.
Our hypothesis is that supplementation of DHA in preterm infants less than or equal to 35 weeks gestation decreases the incidence of BPD.
To perform this meta-analysis, a literature search was conducted using clinicaltrials.gov and the PubMed database. We found 6 primary sources to examine the relationship between DHA supplementation and the frequency of BPD. Gestational age less than or equal to 35 weeks was used in order to satisfy the preterm criteria and include all studies with similar methods. The studies used are all randomized controlled trials that used any form of DHA supplementation. Only trials done after the year 2000 were included in an effort to compensate for the intrinsic incidence and mortality of BPD due to enhancement in treatment and technology. All of our data that we found was input into Review Manager 5.4 software to calculate the risk ratio and the 95% confidence interval and to create a forest plot.
So table 1 shows the total incidence of BPD in DHA groups and the control groups for each randomized control trial. The weight, risk ratio, and confidence interval for each trial, as well for the overall effect, were calculated using Review Manager. A forest plot in Figure 1 was constructed to visually compare the risk ratio and confidence interval for each randomized control trial. There was moderate heterogeneity of 55%. The overall risk ratio was 1.04. However, the results were not statistically significant with p-value of 0.67. The overall 95% confidence interval was between 0.85 and 1.27.
Our results suggested that DHA supplementation of any kind is not associated with decreased incidence of BPD. However, they were not statistically significant. Limitations of this analysis can be due to the inconsistent method and dosage of DHA supplementation. The methods of DHA supplementation also varied. You had direct emulsion and baby formula, and you could also have breastfeeding mothers who consumed DHA-rich capsules. One trial even was terminated early due to the concern of harm. The different gestational age cutoffs can also cause inconsistent results in the meta-analysis.
So in conclusion, this meta-analysis shows that the DHA supplementation in preterm infants less than or equal to 35 weeks gestation does not decrease BPD incidence in those babies. Future randomized control trials on larger scales and inconsistent DHA supplementation methods and dosing may be needed to help further determine the relationship between DHA and BPD in preterm infants. We would like to thank our faculty mentor, Dr. Saridakis, for his advice and support with this project. Thank you.